Okay, so I have my BSI on. I've determined that the scene is safe. It looks like there's one female patient, possibly a fallen. She looks to be in some pain. I'm going to call 911. Hi there, my name is Markell and I'm an EMR. Can I help you?
Yeah, of course.
Okay, what was your name?
Hannah.
Okay, Hannah, and what's going on here?
I was trying to paint my house and I fell off the ladder.
Okay.
I think I hurt my lower leg.
Okay, I'm just going to check out your airway here. If you can open and say, Okay, looks like it's open and clear. I'm going to put my hands on your rib cage. Take a couple deep breaths. Good, looks like breathing is regular and unlabored, bilateral equal chest expansion. I'm going to check your pulse here on your wrist. I felt the presence of a pulse. I'm just going to paint my body with my gloves here, just checking for any blood. I don't see any just yet. Underneath your arm. Just on your legs here. I'll be careful of your lower leg here, but I don't see any blood so far on your left leg like you were explaining. Don't see any blood there. Alrighty, so you said your name is Hannah and do you know where you're at here?
I am outside my house.
Okay, do you know about what time it is?
It's about 4 o'clock.
Okay, and you said you had fallen, right? And just
Yeah, I was trying to paint it a new color.
Okay. Alright, so I'm just going to take a couple of more assessments here. So I'm just going to take your heart rate for a second here. If I could just grab your watch. Okay. Okay, heart rate is 74. It's regular and strong. And let's see here, your respiratory. I'm just going to watch you breathing here. All right, breathing's at 12 respiratory beats per minute there. It's regular and unlabored again. Her skin is pink, kind of cold and dry here. I'm going to check your pupils. I'm just going to put my hand over your eyes here. When I say look at me, 3, 2, 1. Pupils equal, round, and reactive to light. I'm going to make sure I can feel your pulse here on your, oh, I got it this time. Okay, 90 milligrams of mercury on her pulse there. All right, I'm going to start with a more full patient exam here, so I'm going to just kind of move your arm over there. I'm going to check your scalp here for any issues, and you let me know if you feel any pain. I'm going to check your ears for any CSF fluid. Don't see any in your nose or in your mouth there. Smelling for any fruity odor. Don't smell anything there. Can you go ahead and track my finger with your eyes? Good. All right. Checking her neck for any, her cervical spine here for any issues there. Don't feel any. Just checking her clavicle. I'm going to expose as much as I can here. Don't see anything on that shoulder. Any pain there? Mm-hmm. No? Okay, I'm going to do some range of motion with your arm here. Nothing there. Okay, and this one here. All right, good. Feeling your arms. Nothing seems to be off there. I'm going to feel your sternum here exposing. Okay, and then I'm just checking into your rib cage here. I'm going to expose your abdomen if that's okay.
That's all right.
Okay, and then your ribs. Everything's good there. I'm checking her 4 quadrants of her abdomen. Any pain there?
No.
Okay. Good. Did you sustain any injuries to your pelvic area?
No.
No? Okay, I'm just going to move down here. Checking the extremities of her leg. And so it looks like the tibia there. Okay, and your feet and your other arm. We're going to do range of motion on this one. It's a little backwards if that's okay. Anything there?
Nope.
No. Okay, I'm going to have you wiggle your toes for me. Okay, good. And can you push up?
Yeah.
Okay, yep. It looks like your left one is pretty tricky. Can you push down like a gas pedal there? Okay, and what am I doing here?
Scratching.
Okay, and how about here?
Pinching.
On both of them or just one?
Both feet.
Okay, good. I'm going to come up here and kind of do the same on your fingers. Can you wiggle both of your fingers there? Good. Okay, and then grab my fingers here and squeeze as hard as you can. Good. Checking capillary refill. Refills in less than 3 seconds. Can you, what am I doing here?
Pinching both hands,
Okay, and what about this?
scratching both hands.
Okay, good. I'm going to roll you, but onto your right side here to just check out your back area. So if you could just, bring your, because it's your left leg though, right?
Yeah,
Okay, so I'm gonna roll you
that way.
away from it. Yep, so if you could just put your hand up like this. That guy's gonna come like that. And I didn't mention, but if she did fall, I would have a bystander hold cervical spine for us throughout the whole process of this. Okay, and on 3, 2, 1, we're going to roll you onto your side. 3, 2, 1. Good. I'm just gonna check her each one of the vertebrae here, checking for any spinal issues. I am exposing her backside, under her bra area here, all the way down to her lumbar, into the coccyx region. I don't see anything there. I'm gonna check the back of her legs again while she's rolled. Nothing there. Okay, Hannah, would you like to roll back?
Yes.
Okay.
Please.
Here we go. 3, 2, 1. Good. Okay, and bring that one down. So I'm going to splint her tibia. I would splint it in where I found it. I would splint the joint above, the joint below each of the tibia there, the knee and then the ankle. I would check CSM, the presence of pulse, definitely before splinting. I would avoid the void as best I could, and then I would pad the area. I would either put her in a position that is comfortable or where I found her at. I'm just gonna ask you a couple of more questions. So what are some of your signs and symptoms?
Just kind of some like a ache in my leg. Nothing too bad though.
Do you have any allergies to anything?
No.
Okay, any medication specifically that you're on?
No.
Prescribed you're on? Okay. Any past or pertinent history of?
Not related to the leg.
Okay.
No.
And your last intake or output of any liquids or solids?
I just had some popcorn about 20 minutes ago,
20 minutes ago.
and I drank some water then too.
Okay. In the event leading up to it, you were painting, you said?
Yeah.
Okay, so it's pretty on fast then. On
Yeah,
fast.
yeah.
So-
I just fell and it happened.
Okay. Is there anything that provokes it? Like is one spot better than the other to leave it in like this?
This is fine, but moving it hurts.
Okay. So the quality of it is it's pretty achy. You said it's sharp
Yeah,
or dull.
it's like a dull ache.
Dull
yeah.
ache. Okay. Does it radiate anywhere else, like up or down your legs, or is it just right
No,
there?
Just
okay.
right there.
All right. And on a scale of 1 to 10, can you rate the severity of your pain?
Probably like a 7.
Okay. And the time it took place, you said
Yeah, it probably happened like 5 minutes
5 minutes before I
here.
got here. Okay. So at this point, I would just treat her for any shock. I would assess her ABCs and vitals throughout the whole time I'm with her. I would give oxygen if I have it, and I would just keep assessing the patient as best that I can. And I would definitely transfer her to higher care once the paramedics or EMTs got here to the hospital. So
Nice.
good job, patient.
Good job, you.